I'd like to reflect on the title just a little bit, Bench to Bedside. I was thinking about this talk when I found my grandchildren, my wife and I found our grandchildren finger painting in our bed. And I realized that it's more like I'm finger painting in the bed than marching between the bench and the bedside. So I'll reflect on that as I go through this. This is Diamond Black Fan Anemia, 30 years of work in 20 minutes, I hope. I'll define the syndrome, and I think it's important to hear a little bit about the disorder. We'll speak a little bit to the cellular pathology, which drives the model, as Johnson really elegantly described. We'll speak about this class of disorder, the ribosomopathies. I'll speak to two theories to explain the pathophysiology, speak about the cancer phenotype, and then close with the cancer mechanisms. And like my grandchildren, I will be bouncing back and forth. Diamond Black Fan Anemia is an inherited bone marrow failure syndrome, and I think what's key is this low apoptotic threshold of mutant cells. They are fixing to die, and you'll see how that plays into a model of cancer. Bone marrow failure, congenital anomalies, cancer predisposition, and for my internal medicine friends in the audience, these diseases do present in adulthood, and it's the failure to recognize them, as in this young man, that leads to problems. The classical definition defined by Dr. Diamond in 1938 is a moderate to severe macrocytic anemia, so stress erythropoiesis, a reticulocytopenia, as Johnson said, a hypoproliferative syndrome, normal bone marrow cellularity with a paucity of erythroid precursors, and an age less than 1. Now I invite you to my confusion. The advent of more robust epidemiology and better science has created this modern diagnostic criteria for Diamond Black Fan Anemia, and what is definitive but certainly not essential, since we've only, as I'll mention later, defined about 50% of the patients as having particular mutations. Major criteria, positive family history, and the classic criteria I mentioned, and then a whole host of minor criteria that speak to elements of stress erythropoiesis and the lack of evidence of a confounding or other inherited bone marrow failure syndrome, and no evidence of parvovirus infection, which causes red cell aplasia. Now, what is the cellular pathology of Diamond Black Fan Anemia? Well, I'll give you the punchline first. It's characterized by proapoptotic hematopoiesis. And these are some very old experiments in which we separated bone marrow mononuclear cells from patients with Diamond Black Fan Anemia and normal controls, plated them in semi-solid culture medium, and then delayed the addition of the hormone erythropoietin to these culture. The amount of erythroid colonies was dramatically reduced compared to normals as erythropoietin was withheld. And indeed, this is what Diamond Black Fan Anemia looks like. Rapidly loss of all clonality by about 9 hours. And these are the normals, where you can persist in having clonality. Presumably these cells have less erythropoietin receptors and can survive a little bit longer and last for about 2 days. The same is true for the more primitive burst-forming unit erythroid, except it's actually magnified. So we wanted to look and remember the context. This is 1994, so I'm going to show you something that's much less elegant than a Nexon or tunnel assays.